Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody, and thanks for tuning in for Direct Connection. Just ahead, we'll connect you with expert advice on Lyme disease. First tonight, a state commission has made preliminary decisions about who will be authorized to grow and sell marijuana in the state of Maryland. Just across the line in Washington, D.C., that has been legal for several years. So for a look about what is about to happen in Maryland, we are joined now from D.C. by Jeff Kahn, who is founder of the Tacoma Wellness Center. Jeff, thanks for being with us, and tell us what you sell and how long you've been at it.
Thanks, Jeff. Well, we at Tacoma Wellness Center sell medical marijuana. We've been open now for 3 years. We serve 1,000 DC registered patients, nearly 100 people a day, and we do that every day.
And you're number one among the dispensaries in Washington. How did you get to be number one?
Well, I think by serving our patients well and working hard to maintain our patients' trust.
Now, what's legal in D.C.? What kind of prescription does somebody need? What's the process?
Well, to apply to the D.C. medical marijuana program, one must be a permanent D.C. resident and then see a D.C. registered physician who will write a medical marijuana recommendation for that patient. The recommendation can be for any reason that the physician thinks is appropriate. So it basically just takes seeing a physician and being a D.C. resident.
Now, I understand that Maryland's plan is that it's other practitioners other than medical doctors are going to be able to prescribe. Do you see any other big differences between what D.C. and Maryland have going?
Well, every program in every state is somewhat different, and certainly the regulations that we've seen in Maryland look like they'll be somewhat different from the program that we operate here in the district. But time will tell. Most of them end up being very similar after a while because we all take on best practices and look and see what works best in other jurisdictions, and usually end up adopting those as well. It's really a growing and still new concept.
What do you know about your patients, your customers? What kind of conditions have they been prescribed marijuana to treat?
Well, we really see people of all ages, all backgrounds, and with all kinds of conditions. Originally in the district, there were only 5 conditions: cancer, AIDS, HIV, being HIV positive, having glaucoma, or muscle spasticity. Since then, the conditions were enlarged to include any condition that a physician thought was important. And since then, we really see a lot of people who are dealing with serious and chronic pain. People have been involved in all kinds of accidents, automobile accidents and others, and are living with pain and trying to deal with that.
Let me remind our viewers, if you have a question about medical marijuana, you can give us a call. We'll have the number up on the screen. You can also tweet your questions. The Twitter address is @MPT News. So we can see you have a cabinet of stuff behind you. Is that all the same stuff, or are there some differences?
Well, they're all different. We have about 35, usually 35 to 40 strains of dried flower bud on our menu, as well as lots of concentrates and other forms, topicals and liquids, tinctures and oils, lots of different ways that cannabis can be ingested. But here are about 35 different flower types, each with a different cannabis profile, using or featuring different kinds of cannabinoids and ones that have been at least anecdotally found beneficial for different kinds of conditions. So we know that some are helpful with sleeping, some are helpful with eating, some with pain, some with, well, just about all kinds of things that our patients see us for.
Could you hold one of those up just so we can get a better look at what it is? And I'm curious about pricing. You know, what's it cost and how many uses does somebody get out of that?
Well, each strain is a little bit different, but they cost about $18 a gram, and it gets a little less expensive as if they're purchased in larger numbers.
How many grams would be in there?
In here, probably about 4 or 5.
Okay.
Maybe 6. This is a strain called Berry Bomb that's produced by Alternative Solutions, one of our local DC cultivators, and we see the cannabinoid profile that it's 23% THC, 7% CBG, and on from there.
Well, we'll get to the phones, a bunch of calls to get to in a second, but one word you said before was anecdotally in terms of how something has a profile for a certain condition, and maybe that's a little bit of a concern when you think about how opioids are used to treat pain and other conditions. The doctors don't just hand somebody some poppies and say go at it. It's standardized, it's measured, it's put into pill form, and this, it just seems a little more imprecise.
And opioids are really well tested, and what we found is that they're terribly dangerous, highly addictive, and actually many people die from opioid addiction and overdose every single day. What we know about cannabis is that it's safe and it's not toxic. So even though, as you're implying, we don't have the research because the government has prevented the research from taking place, we know from anecdotal evidence from decades of people using cannabis to be able to treat different kinds of maladies, we know what works and what really doesn't.
Let's grab a phone call. Washington, D.C. This is Jesse. Jesse, thanks for the call. Go ahead.
Yes, I was wondering, what are the laws on growing your own and personal consumption?
Thanks very much. And
Sure.
Jeff, that's changed, right?
It has changed. In the district, we've passed recently Initiative 71, which gives every adult over the age of 21 the right to be able to grow cannabis at home. So our patients can do that. Any adult in D.C. can grow plants and possess up to 2 ounces at any time.
Call from Anne Arundel County. This is George. George, thank you for calling. Go ahead.
Hey, dude. Just kidding. Hey, I did want to just make one comment that for those who didn't know, that apparently in medical marijuana, the psychological or the piece of the chemical that makes people high has been removed, and so it really isn't what a lot of people think it is. Right, but I would like to know in D.C. whether they can acquire if a retailer like your guest can acquire the product from out of state, since there is a federal law against it. And I've heard that in Maryland, one of our big problem in trying to make the current law effective is that there's some defect in the process of getting people licensed to grow it to be able to provide it to the retailers.
George, thanks very much for the phone call. Jeff?
There are 7 operating cultivation centers here in the District of Columbia that supply all of the medical marijuana that's available here. None of it can come from out of state. It's against the law. The laws are complicated, but there isn't a case where one state exports or imports medical marijuana from another. There are THC is the cannabinoid that is the most psychoactive. So usually, if there's a high percentage of THC in the flower, then it will get you high. Some strains come with very low levels of THC or no THC, but here in the district we do sell cannabis with high levels of THC, and so that's not really an issue here.
What do you sell the most of? Do you sell much of the low THC stuff?
Not as much, but lots. I mean, and there are a lot of people who are using high CBD forms of cannabis, and to great success.
You know, one of the interesting side notes to your story is that you are an ordained rabbi. How did you wind up trading a pulpit for what you're doing now?
Well, I guess a combination of after 30 years in the congregational rabbinate, looking for another way that I can really work with people and help people. And my late father-in-law, who passed away in 2005 and lived more than 50 years with multiple sclerosis, and after trying just about everything imaginable, finding great relief from cannabis. And so a family history of knowing that medical marijuana works.
Let's take another call from Washington. This is Angela. Angela, thank you for calling. Go ahead.
Yes, good evening. I have sciatica and chronic back pain, and I'm asking if the oil or smoking marijuana would be best for a patient like myself. And secondly, I don't want to get high, so would it be possible to get an oil or a low-high marijuana for my muscle spasms?
Angela, thank you.
We do have a CBD oil that I know people with sciatica who have used it with great success. They found that after a few days of using it, the sciatica really disappeared, and that as long as they have a dropper a day, it stays away.
Previous caller.
So I would think you would be a great candidate.
Let me ask you this. A previous caller raised the question about this being legal to a certain degree in D.C. and soon to be Maryland, but still illegal at the federal level. A couple of complications come to mind. One would be somebody who is in possession but is on federal property, which there's a lot of in D.C. And then the second part of the question is from a business standpoint in terms of being able to take in money, take it to the bank, pay your bills. Do you run into any issues there?
Yes, and there are a lot of complications because of it being illegal at the federal level. Banking is one of the problems. We're lucky that we have formed a very good working relationship with a local bank, and so we don't face a lot of the issues that other people in the medical marijuana industry do. But there are a lot of issues having to do with federal law that keeps medical marijuana from really being able to help a lot more people than it could help.
My guess would be that once this is legal in Maryland, there will be people trying it recreationally who maybe hadn't wanted to do it when it had to be acquired from a dealer illicitly and you never knew quite exactly what was in it. So in terms of somebody trying it for the first time or the first time in a long time, either recreationally or medically, any advice, any thoughts on that?
Well, we see a lot of people who are trying cannabis for the first time, and we tell them to go low and go slow. We believe in microdosing. We believe in trying just a little bit and waiting a while and seeing if that works and perhaps adding a little bit more. And so we work very closely with our patients when they first begin to find the best methods of ingestion and the right strain and really the right way to do it for them. There's lots of different possibilities.
Call from Cecil County. This is Sheila. Sheila, thank you for the call. Go ahead.
Yes, I have a lot of pain in my knees. One knee, I was in a car accident, broke my kneecap in half, and it's been giving me a lot of trouble. Will this help it? Like a lot of inflammation.
It certainly could, and you also sound like a great candidate for medical marijuana. We find that a lot of people who sadly have been in automobile accidents and other accidents and are living with chronic pain and not able to really find a way to treat it well enough to be able to go on, find it real help with cannabis and find a way to be able to go back to living and stay away from opioids.
Let me get your thoughts on a couple of studies I've seen recently. One indicated that in states that had legalized the medical use of marijuana, the prescriptions of painkillers, the opioids we had talked about, have decreased. But then there's also a study out today or this week from the Heart Association saying that marijuana smoke, secondhand marijuana smoke, is potentially more dangerous than tobacco smoke. What do you think?
I haven't seen the second study. It seems kind of far-fetched because the things that make tobacco smoke really dangerous, the carcinogens and the tar and the nicotine, they're not present in cannabis at all. Cannabis is not toxic, and that smoking can be irritating, but it really doesn't cause cancer. But besides that, there are lots of other ways to be able to ingest cannabis. So if somebody wants to stay away from smoke, even because they think that it might irritate somebody else in close proximity, they can ingest their cannabis in lots of other ways.
Last question. Have you ever had to turn somebody away, somebody who came in with maybe looked like a fake card or something?
We've never really had anybody come with a fake card, but we have about a dozen people a day come to the door, many of them Maryland residents who would like to be able to use our services, and unfortunately we can't help them. It's really been, the only word that I can think of is tragic, the way that we've had to turn away Maryland residents from our program when we're confronted by people in such need, and we know that we can help them. So we're really thrilled that the Maryland program will be starting soon. We hope that we'll be a part of it, but nevertheless, we're delighted that this kind of relief will come to Maryland.
Jeff Kahn, Rabbi Jeff Kahn, founder of the Tacoma Wellness Center, joining us live from Washington. Sir, we appreciate the time.
Thank you.
Thanks again. Coming up tonight, signs and symptoms of Lyme disease and how to prevent it. We'll be right back.
Oh, sometimes
the tears.
I get a good feeling, yeah.
Wanting to die. Nobody tells you.
I believe
that without it,
I really do believe that
life can be appallingly boring.
Something's got a hold on me here.
You're making a mistake.
Am I? This is really very promising.
Something's got a hold on me right.
I don't think this is such a good idea.
You've been talking to my mother.
I am about to commit murder.
She always had a bit of a dark side. Trying to scare me now. It'll give you a story.
He's in love.
I really wasn't. Stay away from my wife.
Any idea the pressure I am now under?
There is one stage that is the Met and Carnegie Hall. It is the Kennedy Center and a club in Austin. It is closer than any seat in the house, no matter where you call home. PBS, the great American stage that fits in every living room. Supporting your PBS station brings the arts home.
This is a box that showed you a world beyond your own. It was just a box, but the world has changed, and so have we. And now the box can be almost any size or shape. And you decide what you want to explore. Anytime, any place. Break out of the box with PBS.
My child is watching.
And joining us for this week's Your Health segment is Dr. Fahim Yunus, Chief of Infectious Diseases at the University of Maryland Upper Chesapeake Medical Center and Clinical Associate Professor at the University of Maryland School of Medicine. Doctor, thank you for being with us.
Thanks for having me, Jeff.
We want to focus on Lyme disease, and the number of people who get it every year is surprisingly large.
Very high, yeah. CDC has said over 30,000 people in U.S. get it every year. However, the real number is going to be 5-10 times more because not every infection gets reported. So yes, it is quite common.
Does everybody who gets the infection know that something's wrong?
Fantastic question. There are some people who will remain asymptomatic and will never know. However, in most cases, within 3 to 30 days of a tick bite, you will start feeling a flu-like illness.
Now, transmitted by ticks.
That's right, a deer tick.
And that's not the tick I'm most familiar with, I think.
That's right.
I remember a tick that's sort of the size of like a, pencil eraser.
Exactly. The Lyme disease tick is exceedingly small, almost the size of a sesame seed, like this small. This is not a real tick. I just made something up. But when it gets stuck to your skin and then gets engorged with blood, it can get this large, from 2 millimeters to perhaps 5 millimeters. So it's much smaller.
If someone finds one of those on their leg or something, what do you do?
Well, the best thing is to try and remove it. If it's not stuck with your skin, if it's not engorged, you're not at risk of anything, because it typically takes 36 to 48 hours for it to transmit the disease. It's a pretty common, but at the same time, very inefficient bacteria, and very inefficient disease. But if you do find it engorged and it's deeply stuck, then you gotta take some regular tweezers and try to pull it off.
It was always said that there was a telltale rash. Is that always the case?
In about 70% of the patients, yes, they will have a rash, and yes, it can become bullseye with some fading in the center. Most commonly, these rashes occur at hard-to-find spots, like in your groin, in your scalp. So you really have to look hard. Absence of a rash, however, does not mean that your symptoms are not due to Lyme disease.
So this is a disease that I may not see, and it may be asymptomatic. What would make somebody seek medical help?
Most of the time it is symptomatic with a flu-like illness. People will start feeling headache, achiness, joint pains, fever. Those are the symptoms, even if you don't have a rash. And here's the interesting part. According to some studies, up to 70% of the patients will not remember having a tick bite. So just because you don't have any memory of a tick bite does not mean that you don't have Lyme disease. If it's the right season between April to September in the Mid-Atlantic states, yes, you should think about it.
The symptoms sound like a bunch of other conditions.
That's right. Very nonspecific.
So how frequently is it misdiagnosed?
I think it is, any disease can be missed, but most of the time with astute clinicians, this is very common for us to think about it in the right season. So I think a lot of people make the right diagnosis.
Let's take a phone call. Montgomery County, this is Ken. Ken, thank you for the call. Go ahead.
Yeah, doctor, I was wondering, the blood test that they take, can it distinguish between a recent infection and an infection that wasn't recent? And the other question is, how reliable are the tests on the tick itself?
Very good question. I think, yes, in certain cases, it depends. Blood tests by themselves don't mean much in Lyme disease. They have to be put together with the clinical picture. And if you tell me that you went camping 2 weeks ago and now you come in and your blood tests are positive in a certain way, yes, we can tell that it was a recent disease. What is also important to remember that some of these blood tests can remain positive for 10, 20 years after the infection. So yes, you may have had this disease 10 years ago, treated, cured, and we may see signs of that. The tests on tick itself are done just for research purposes. Usually they don't serve much clinical benefit, and I have not seen that happen commonly in clinical practice.
Let's talk about treatment. Response to antibiotics?
Very good. That's the best part. Living in United States, 2016, very, very few people die of Lyme disease. To a point when someone dies, it's a case report. It gets published. You can get treated from anywhere from 2 to 4 weeks of usually pills. And in severe cases, if it goes to the brain or to a joint, it's still treatable. But then we sometimes use intravenous antibiotics.
I know people who have had lengthy courses of dealing with Lyme disease, years of symptoms. Is that common, and what can be done?
That's a very difficult scenario, and I think I first of all empathize with those people because their symptoms are real. However, research on thousands and thousands of patients over the past few decades has shown that those symptoms do not respond to long courses of antibiotics, and actually their symptoms may get worse and they may have more side effects because of it. So in a way, if I lose power in my house, I will not call a plumber. What I'm saying is, yes, there is something wrong with your body, but long-term antibiotics is not the answer to that. The answer is something else, treatment for fibromyalgia or perhaps chronic fatigue, other things. And long-term antibiotics can do a lot of harm.
Phone call from Worcester County. This is Donald. Donald, thank you for calling. Go ahead.
Doctor, I've had Lyme disease at least 8 or 9 different times, probably even more than that. And over the years, each time I've gotten it, I've gotten sicker and sicker. And I've recently been diagnosed with a terminal illness. And I was wondering about the involvement of Lyme disease with, the development of severe pancytopenia with neutropenia, T-cell lymphoprolific diseases, and other diseases of that sort.
Grief. Donald, thank you for the call. Good luck.
My heart goes out to you, Donald. Very sorry to hear about what you just said, but typically Lyme disease should not do that. If it happens for a very short amount of time and it improves with treatment, but typically, no, it should not cause long-term cytopenias.
You mentioned the seasonality of it in terms of how a clinician might look at symptoms. Summertime, or is it more specific than that?
Yeah, typically late spring to summer. It starts somewhere around April and then peaks in the summer, and by September starts trailing off.
Let's squeeze in one more phone call. Montgomery County, this is Lawrence. Lawrence, thank you for the call. Go ahead.
Sir, how far along are they in developing a vaccine against Lyme? And I realize, too, that there are several types of bacteria-borne tick illnesses that are sometimes confused with Lyme.
Great question, Lawrence. There are 3 diseases that the same tick can carry: Lyme disease, ehrlichiosis, or babesiosis. So the fortunate thing is that 2 out of those 3 can be treated with the same drug, same medication. A vaccine for Lyme disease did come out actually in 2002, and then was taken off market because of multiple complicated reasons. One of them that it required a booster shot every year, every other year, and there was some theoretical risk that actually it could exacerbate joint pains. So there was some research on the vaccine, but so far the only vaccine that came out was pulled off the market.
I just have half a minute, but is there any particular repellent or strategy to avoid ticks that you prefer?
Well, most important, go live your life, have fun. Don't become paranoid, but all the regular off or cutter or DEET containing repellents that you are commonly finding in your stores, they're all good. Wear long sleeves if you're going out vacationing and things like that. But most importantly, live your life, have fun.
Dr. Yunus, thank you for stopping by. We appreciate it, and thank you for joining us for Direct Connection. Have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.